Good morning. Today I am joined by Deputy Medical Officer of Health, Dr. Ivan Muscat. We're here to announce the Government of Jersey's updated COVID-19 strategy for winter, which will outline how we plan to continue the suppression of COVID-19 in the island, ensuring we safeguard public health and well-being, while balancing the need to keep our children in school, our businesses open, and our island running as normal as possible. The situation around us is once again changing dramatically, with France and now England going into lockdown measures. We are acutely aware of the good position we are in, but how fragile maintaining that position can be. We published our original COVID-19 strategy back in June. This is an updated framework to guide us through the next 3 to 6 months, built on the greater knowledge we have of the virus and how we will need to conduct ourselves to suppress it during the colder months. We will not be following what either the French or UK governments are doing, because their situations are very different. Nor have we waited to see what they are doing, because whilst our connectivity to them is important, what we are doing is right for Jersey. We want to avoid blanket restrictions which impact widely on islanders, their mental health, their job security, and their social interaction. Our goal remains, above all, to protect the health and well-being of everyone, but especially those most at risk from the virus. And this approach is based on updated medical advice from STAC. We know that winter naturally increases the risk of the virus transmission due to a number of factors, such as increased time spent indoors and the increased occurrence of other respiratory illnesses, such as flu. We have begun to see an increase in active cases of COVID-19 in the island this autumn, with the occurrence of different types of cases, including those of unknown source. And we understand this raises concerns, but it was expected and can be seen in our sister island as well as in all those jurisdictions around us. Through our robust measures and investment in tracking and tracing, we have kept onward transmission incredibly low. This winter strategy outlines how we will continue to manage increased seasonal risks while seeking to avoid disproportionate, restrictive, island-wide measures on the whole population. We will instead focus our efforts on targeted and direct action based on evidence which will minimize the overall harm to islanders' well-being. At the beginning of the pandemic, with our systems not yet matured and our understanding not as rich, we needed to act quickly by introducing firm restrictions on the whole population. The initial lockdown protected the health of islanders from a highly contagious virus that we knew very little about at that time. This was a heavy decision to take, as even then we knew that restrictive measures like lockdown can be harmful to livelihoods, mental health, education, and the economy, and we want to avoid the need to implement them. Our world-class health service depends on our economy. Our track and trace, our testing, and all our government financial support packages are eventually paid back by islanders, and so to limit and restrict their livelihoods will quickly limit and restrict the scale of government support and response. Our winter strategy aims to prepare, prevent, and protect islanders against these indirect harms by balancing the risk of the virus spreading within our community and sustaining a level of normality within our economy. We already have strong public measures in place which have served us well so far. Our border testing measures rank amongst the most comprehensive in Europe, and we have an excellent test, track and trace program with a dedicated team, which is now also supported by our COVID Alert app. The Council of Ministers' commitment to put children first runs through our policy work, and we will do everything possible to avoid disruptions to schools. STAC evidence and advice confirms that a balance can be achieved between the risk of ongoing infection and children's education and well-being. We will support that balance throughout this winter by keeping schools open and avoid prolonged student absences. We have agreed 8 areas of focus to navigate the island through the winter months and avoid disproportionate restrictions on the way. Firstly, we will increase our testing and tracing capability with an enhanced workforce testing programme. The government will now be offering COVID tests to a wider demographic of employees across industries who are at higher risk due to the nature of their public-facing roles. The goal of our contact tracing team is to identify positive cases and those who are found to be direct contacts of these cases. Targeted contact tracing breaks the chain of the virus spread by asking those identified to isolate. We've built a team of 55 individuals who investigate the source of the virus and support those in isolation with their practical and emotional needs. This work has been incredibly effective and is a key factor in reducing our transmission in our community. Dr. Muscat will shortly give more detail on that programme. Secondly, we'll continue to monitor the risk from countries and regions and apply changes to our safer travel policy. We will continue to change the classifications of countries and regions as necessary and continue a daily review of how cases are changing internationally. This is important as we still have islanders returning to Jersey from essential travel. The numbers of passengers arriving in Jersey has dramatically decreased, but the percentage of those passengers found to be COVID positive will likely increase in the coming weeks due to the high prevalence of the virus outside of our borders. Our continued monitoring of countries' risk will determine the isolation requirements on those arriving passengers, and we're making sure that they get the support they need when undertaking this isolation. Our monitoring and enforcement team will ensure arrivals and their direct contacts are adhering to the requirements, and the law will be strictly enforced against those who are found to be in breach. May I just take a sip of water? Thank you. And thirdly, within the last week, we introduced a new policy for masks to be worn indoors in public areas. And this policy applies to areas where contact tracing and physical distance cannot be guaranteed. This means places where the public interact, but names are not recorded. For example, supermarkets, banks, and the bus station. The States Assembly will consider legislation to make mask wearing mandatory, but right now, we all have the power to act responsibly towards each other by putting on a mask to reduce the risk of infecting others with this harmful virus. Fourthly, we will review our guidance for those islanders who are at moderate and higher risk. We acknowledge that implementing more defensive guidelines for these groups may have indirect negative impacts, such as social isolation. For the time being, all those at higher risk of serious illness from COVID will continue to be advised to follow personal risk-based decisions with the help of our framework, which outlines the risk levels for certain activities. We'll continue to review the types of cases we have on island, and if necessary, bring in enhanced guidance for this group with their core well-being in mind and a support system prepared for any outcome. Fifthly, we've already seen a successful take-up so far of this year's flu vaccine. Vaccine stocks continue to be ordered and received by both government, pharmacies and GP surgeries, who are all working together to deliver the flu vaccine to a wider group of islanders. We're due to receive a batch of 20,000 vaccines this month to continue vaccinating higher risk islanders, and I thank those who've been successfully encouraging a greater take-up this year, We've already broken records with the number of health staff we have vaccinated, with a 10% increase in take-up already, which puts us in a good position with maintaining a strong workforce. Sixthly, the government will continue to prepare for the delivery of a COVID-19 vaccine. Now, there's no guaranteed date when a COVID vaccine might be available, but we can be ready to receive and deploy the vaccine as soon as it is available. Good progress has been made on building a team of vaccinators within health service for peer-to-peer vaccinations, and work continues in planning for the deployment of a vaccine which is likely to begin in early 2021. Seventh, government departments have been preparing COVID response strategies to ensure government services can continue. Health and Community Services has planned what support is required to reduce the risks for patients and the health and social care workforce over winter. We want to minimise disruption of our services by ensuring the core functionality of health and social care is maintained. These departmental plans also ensure that if escalation of the measures is needed, we are prepared. This includes ensuring our emergency capabilities are maintained, such as PPE supplies and the readiness of the Nightingale wing should it be needed, which we remain hopeful it will not. And finally, we'll continue to focus on how our messages are communicated to the public. It is crucial islanders continue to understand and adhere to public health guidance. Our communications will fall under three themes: prepare, prevent, protect. We'll continue issuing advice and guidance aimed at bolstering public confidence in the work the government is doing, responding to this pandemic. With Christmas around the corner, we know this is an important celebration for many islanders to plan. We've set up a task group to provide advice and support and offer guidance on how to proceed with planning events safely. And we'll provide further updates on this in the coming weeks. While we continue through this challenging time, and as we come towards the end of the year, I want to remind us all of the inherent strength and security we have as an island community. Our island is a special place, and we can respond with the shared incentive that our individual actions can play a part in keeping it a safe place. Our actions have an impact not only on ourselves, but on our friends and family and on our neighbours, also our bus drivers, shop workers, cleaners, our tradespeople, businesses, and our health and care staff. Our individual actions have an impact on everyone, and I must therefore urge islanders to follow the public health guidance, and I thank those of you who've continued to do so. Without your response, we would not be in the strong position we find ourselves in today. I will now hand over to Dr. Ivan Muscat, our Deputy Medical Officer of Health, who can tell us more about the enhanced workforce testing programme. Thank you.
Thank you, Minister. Winter brings us many health challenges. As the weather becomes colder and wetter, we spend more time indoors, and the respiratory viruses like flu and now COVID increase. Across Europe, COVID-19 infections are seeing a sharp rise, which has led to the strengthening of our travel policy measures. Throughout winter, arrival numbers will drop as people tend to travel less, but we will see an increase in the percentage of positive cases coming through our borders. With most of the countries around us now in some form of lockdown, it is likely that numbers of arrivals will be very small indeed. But we have COVID cases already here on the island, and many other countries who have locked down for significant periods have also seen new active cases crop up as we move into winter. To mitigate against this increased risk of onwards transmission, in the island and the increased risk of severity of infection, we must be winter ready. An enhanced workforce testing program will work alongside the existing border program. With the increased likelihood of island transmission and sources no longer being traced to the borders, we need to ramp up PCR testing within the community to identify cases, contain them, before infection is spread to others. We have identified priority groups of employees across a number of sectors who are at higher risk of COVID due to the nature of their public-facing roles. Increased testing within these groups has huge importance for the island this winter. This measure, of course, is over and above the continued screening of symptomatic individuals and admissions to health facilities. Furthermore, this testing program will provide information on COVID activity in the island and help direct our responses accordingly. It is flexible and responsive and will be tailored to react to any changes we see occurring within our community. The priority is to test not only people who are more likely to contract COVID-19 because of where they work, but also those who are more likely to transmit infection, with a particular emphasis on those more likely to transmit infection to those at risk or in enclosed communities, like care homes, for example. We want to proactively seek out the virus and prevent COVID clusters to keep people healthy and help keep our services and the island economy running. Some 60% of the island's workforce will be asked to join the enhanced testing program, and they will undergo regular PCR swab testing at frequencies based on the risk of infection and the risk of onward transmission. Workforce testing will continue and indeed be increased for frontline healthcare workers, such as those who work in the hospital, in community health, in care homes, in primary care, and the ambulance service. Employees will initially be split into 3 groups depending on the frequency of testing. Some will be tested every 4 weeks, some every 6 weeks, some every 8 weeks. The schedule of proactive PCR testing will be continually reviewed to adjust to infection patterns and trends to ensure that we are doing everything possible to protect workers and the community. This may very well include an increase in the frequency of testing amongst certain groups, if we find or we believe that there is an increased risk. For this important measure to work properly, it is vital that as many workers identified within the relevant sectors participate in the program. The test will involve a simple swab taken from the back of the throat and the front of the nose. We are testing to determine if someone has the virus at the time of the test and not to determine if someone has had the virus previously. We are not looking for antibodies. We will not require any period of isolation before results are back, but if a positive result does come back, then that employee will need to isolate for the usual 14-day period until recovered, and contact tracing and further testing will take place. Due to the continuous nature of this testing, we can't, of course, be isolating people before they get the results back. This is a surveillance system. If we don't employ these preemptive measures, then infections will continue to present themselves in the community, but in larger numbers and with more severe outcomes, putting many individuals and indeed the island at greater risk, such that more restrictive island-wide measures may need to be considered. And of course, we want to avoid that. Businesses have been contacted about this testing program, and I strongly encourage workers in the invited sectors to be tested regularly and be proactive in helping to keep themselves, their loved ones, their colleagues, their industry, our community, and our island safe. No single measure will work by itself to protect us from COVID. We all need to additionally adhere to public health guidelines, which are hugely important, and therefore I will continue repeating these in order to help keep us all safe. Increased hygiene involving washing hands regularly for at least 20 seconds with soap and hot water is very helpful. Indeed, washing your hands 5 times a day or more will reduce the risk of you getting COVID. Use alcohol hand gel and wear masks when entering indoor public places. Use the contact tracing QR codes in venues and download the Jersey COVID app. Maintain a physical distance of at least 1 meter when possible from those you do not live with. If you can keep 2 meters apart from people you do not live with at any one time, then please do so. That is safer still. Keep gatherings limited to 20 people or 40 for controlled events. If you are unsure, the guidance is online, or you can call the helpline for advice. The wearing of masks is fundamental to reducing the spread of infection in the community. Masks act as a barrier to the droplets that we exhale when we breathe, talk, sneeze, or cough. Wearing a mask in indoor public areas is a huge service to your fellow islanders. As the Minister has said, these measures act as protective layers. The more layers we apply, the more protection we have. We have done well so far in keeping this virus at bay. Please continue to act responsibly, with an awareness that we are not immune to this virus or its impact. We need to respond. Your positive actions will help the island get through the next 6 months. Thank you.
Thank you, Dr. Muscat. So we'll now have a period of questions, and I suggest 2 questions each. And on my list in front of me, I have Gary from ITV, Elodie from Bailiwick Express, Charlotte from BBC, Harry from 103, and Tom from the JEP. And I suggest we take each of you in that order. So Gary first, if you would.
Health Minister, first of all, what's going on with masks? In April, May time, Dr. Ivan Muscat was privately saying he supported the wearing of masks. It was a week to 10 days before any government announcement came out in a very half-hearted way. In recent weeks, we strongly recommend the wearing of masks. We've had you last month saying, I'm going to bring forward legislation. That legislation may not even be considered till December. Ivan Muscat, while you're talking, is wearing a mask. You're not wearing a mask. It all just feels totally muddled. I'm told the Libertarians in the Council of Ministers have begged you to pause making this mandatory. Dr. Ivan Muscat could not have been more explicit about how vital wearing masks in public places where we can't ensure distance is. What the hell's going on?
So, Gary, the whole world, and especially the scientific and technical experts, have learnt so much more about the measures that are effective to deal with coronavirus since the peak that occurred in many countries in March, April, May. At that time, yes, there was talk about masks, but there was uncertainty about whether they might be effective or not. Now I think the evidence is far more robust, and we have been studying that evidence locally. We believe that there is good evidence that mask wearing is one measure. It's not the panacea. It's one measure that will limit the spread of the virus. So in places where we cannot control the distances we keep from each other, as we are doing here today, that's entirely appropriate, and that is highly recommended. Legislation is hard to draft sometimes. This is an unusual area to be making law in. Legislation is being prepared and will be lodged, and the states will debate it and make that decision as to whether government should be given the powers to make it mandatory. But for now, it is very strongly advised, as you said, and we are seeing a take-up because I believe people are understanding that message. And the simple, it's not universal, I agree, but more and more people are wearing masks in the venues that we ask them to.
I went into 4 shops at the weekend. I was the only person wearing a mask. I'm sorry, that's nonsense.
Yes, I went into shops also. Some of the shops, I thought 50% of people. There's going to be a build-up, isn't there? And we will continue with our programme to communicate this. And I don't know if Ivan would like to add anything at this stage.
I think the more noise, if you like, that we make about the importance of wearing masks, that we make about the importance of public health measures as a whole, the more the uptake will be. And looking at what's happening around us, looking at the lockdown the United Kingdom have gone into, looking at the lockdown France went into beforehand, should surely encourage us to take preemptive measures to avoid us going down the same route. That is what it's all about. That is what all the effort is going into.
And my follow-up question, is it a hindrance that within the next 2 weeks, Health Minister, we could have a new Chief Minister because of a vote of no confidence? Or is it actually helpful to have potentially some fresh blood to drive some fresh impetus at this very point where we're looking at the winter plans?
I'm not going to rise to that, Gary. I've not even seen any sort of proposition yet. So where I'm concentrated, teams are concentrated on preventing the spread of this virus, getting out the message to ask people to protect themselves and protect their loved ones so that we can avoid the sort of lockdowns that we're seeing in the neighbours around us.
With the current Chief Minister, ideally?
That's a matter for the States Assembly.
Including you, you're one of them.
Including me, but I'm here to talk about our winter strategy, not to comment on what may hypothetically be coming forward.
So you can't yet back him?
I'm going to talk about our winter strategy today, Gary.
Okay, thank you.
Next is Elodie.
Good morning, both. We've heard of cases of individuals who tested positive after being told they don't need a test when they call the helpline. So what criteria are those on the hotline using to triage people? Or they're medically trained to make decisions? And is this criteria going to change throughout the winter?
Could I ask Dr. Muscat to take that?
The people on the helpline do follow the guidelines that we have provided them with, but we accept that as we go into winter and as the frequency of symptomatic COVID and COVID as a whole goes up, we should be much more inclined to test people for COVID, even if they do not fit the classical criteria completely. We have already embarked upon that pathway and are encouraging the helpline to test as many people as possible, because that is also part of the way in which we can control COVID.
And you mentioned the criteria and the guidelines. Can you explain what those are and how they work?
The current classic criteria are a fever or history of fever, a new cough, a new continuous cough, or a change in taste or smell. But other features of viral infections, such as headache, muscle ache, feeling tired, fatigue, malaise, and in some instances gastrointestinal symptoms as well, particularly in children, should all elicit a COVID test. I think as we go forward, we need to increase COVID testing as much as we can, and that is in keeping with the philosophy, of course, of testing the workforce. We are testing the workforce, the asymptomatic workforce, in order to pick up COVID before it becomes symptomatic in themselves or in others, and before it spreads to others. So when symptomatic people do make themselves known to the helpline, we should be screening them as well.
Then my second question was about the unidentified COVID cases in the community. How many have there been? And are you planning to use the shelved antibody test to better understand the spread in community?
Sorry, was that identified?
No, so the cases where you couldn't identify the source of infection, how many have there been recently?
Would you?
So the way we approach cases in the community is that we delve into them, we deep dive into the details of that case as much as possible, and that includes their history, their contacts. We look at all their direct contacts and often their indirect contacts as well, in an attempt to understand the situation, but also very importantly to actually capture as many of the positive cases as possible within that network, if you like, in order to manage people appropriately and from a medical point of view, and also prevent onward spread by appropriate use of quarantine or isolation. If in the process of throwing out that extensive sort of net to capture as much information as possible, we eventually conclude that we can't find a link to arrivals, then we conclude that it is of unknown source. And to date, we have closed 2 such cases where, despite very extensive investigation through a number of measures, but in particular through the contact tracing team, we have not managed to find the source, and we've concluded that they are of unknown source. There are a number of other cases which are currently still being actively investigated, and where therefore we can't come to a conclusion as to whether they will eventually turn out to be arrivals related or not.
Thank you. And so the second part of the question was about the antibody test. Are you planning to use them then too?
So we are not going to be depending on antibody testing. We've learned, as the Minister said earlier, we've learned a lot from this last winter. And one of the things we have learned, not just in Jersey, but elsewhere as well, of course, is that antibodies do tend to wane with time. And there is an important study from Imperial College that has shown that after about 6 months, a significant proportion of people with antibodies lose those detectable antibodies. Additionally, there was a report from Madrid, from Spain, saying that despite the very large outbreak earlier on this year, the number of positives that they had at the end of the outbreak in Madrid was still about 4 or 5%. That's antibody rate. And they therefore indicated that there is little point in actually looking at antibody status to help determine the way forward. That doesn't mean to say that you can't create an immune response to the virus. That is another matter. But using antibodies to determine where you are is not reliable.
So what's going to happen to the tests that were ordered and not used then?
Well, we bought them at the time because we felt they would be important. We bought them at a time when there was no experience in using antibody testing, because COVID didn't exist before earlier on this year, and we anticipated that it would behave like other infections, and that antibody testing would therefore be helpful in determining how many people would have developed infection in the past and how many are therefore now immune. As it turns out, over the last many months, we've learned that that is not the case. So we're not going to put our efforts into something which is not going to give us the information that we need. We need to put our efforts into something that will give us the information that we need, and not only that, that will help protect the community. So we've shifted to putting our energies into PCR testing, ramping it up via the helpline, as you indicated, and ramping it up through workforce surveillance in asymptomatic individuals. We're talking about potentially something like 40,000 people in the workforce surveillance scheme, which is, coming towards 40% of our population that will be repeatedly tested, and they will be repeatedly tested because they are public-facing, and therefore not only more likely to catch infection, but also to transmit infection, with a particular emphasis to those who can transmit infection to the vulnerable, especially in enclosed communities, which potentially are super-spreading sites. So that there's been a shift in our emphasis as a result of what we've learned.
Okay. Thank you very much. Thank you.
Charlotte?
Elodie's question about the helpline. It's a service that's supposed to be helping islanders, but why are people calling it up calling the hotline up with symptoms and not getting tested? Are we not missing key potential clusters in the community? And are we repeating the same mistakes as last time?
It's interesting. If you have instances of that and people feel that they haven't been getting the service that they required from the helpline, please let us know. My understanding, as Ivan has explained, is that with the people operating the helpline, there's a discussion about the symptoms that they are exhibiting, and if those symptoms point towards COVID, and the people manning the helpline will have guidance on that, then they will be asked to take a test. But we must remember that we're coming into a winter period where colds are very common. So it's not guesswork on their part. They have procedures which Dr. Muscat will have informed that will try and distinguish between COVID and colds, for example. But, you know, please tell us if you learn of others who have subsequently contracted it and how we might, how it's felt we might improve things.
Okay. I also want to talk about vulnerable islanders. This is obviously undoubtedly going to be quite a scary time for them. I know you spoke briefly about it, but what guidance are we expecting to see for vulnerable islanders as we go into winter?
The current guidance, which we hope to continue, because we have cases low in the island and we're controlling the spread of infection. Current guidance is that we would ask those at high risk to have regard to the classification of risk that we've put online and in all our literature, and make their assessment of what they feel is appropriate for them. Because we acknowledge that government can't tell people who have different ways of approaching their own assessment of risk. So it's for people to make those decisions for themselves, what they feel comfortable in doing in the light of our guidance. Now, if we do enter a period where things are more serious and we have increasing spread of infection in the island, then we will have to change that guidance. And we will perhaps be urging people to take far greater caution. But we'll see as it develops.
Okay, what is the support system that you were on about earlier?
So there is a support system which is called Connect Me, in which high-risk islanders can phone or make contact with people who can then point them to services or request parishes or voluntary groups to help them in practical ways, such as doing their shopping, so that people in those groups need not go out to the supermarket to buy their necessaries. So whatever help they may need to maintain themselves and keep safe.
Great, thank you.
Thank you. Harry.
Thank you very much. Good morning. First of all, I'd like to ask something that I've seen on social media, especially this week, that's been of concern to a few people. You mentioned, obviously, the rising cases in many places elsewhere, and obviously we're seeing lockdowns everywhere, but yet the current rules, as I understand it, that if people travel out of the island but come back in the same day and don't sleep in a certain place overnight, then they are not subject to certain rules on isolation on their return. Given that cases are so high elsewhere, that we're seeing lockdown in these places, is that still sensible?
We're always keeping our procedures under review, but of course, in order to communicate a strategy and have it workable, you have to have some rules around it. And the decision was taken to use that where you spend the night as the way we would control. And we have successfully controlled the spread in the island with limiting those numbers and ensuring that those who do come in that test positive. We are always looking at different ways, better ways if it can be, to keep islanders safe. And we will keep that under review. Ivan, do you wish to add anything?
Certainly, we have to be dynamic in our response, and as things change around us, or indeed internally, we need to change with it. So at the moment, people who have a sort of day trip, if you like, to the UK, which is largely the bulk of travel, then they're managed as green cases when they return and have a swab on return, but don't need to isolate until the result is back, but don't need to isolate until they have their day 5 test. We will be looking at how we manage borders as a whole as we go forward, and one of the things that may change the way we think for the better is increased availability of testing, and that might also affect, for example, the degree of quarantine that individuals need to undertake when they come back from red areas. I'm not promising that is definitely going to happen, but it is one of the things we are thinking about and looking at the moment.
Okay, just looking a bit simplistically, it just seems, seen from islanders on social media, as I say, that you could spend 10 hours in somewhere that's a red zone and travel back on the same day, and yet they're not subject to somewhere if they arrive on an evening, sleep over, and it could be fewer hours that they spend in that place. It just seems completely backwards to a lot of people. Do you understand that?
I can understand what you say, but the difficulty is you have to have some way of implementing the system. And I think, Harry, that we are going to see far fewer people travelling in the next few weeks. We also don't know what the travel operators will be doing with a lockdown in the UK. So I think we must concentrate our efforts on our on-island measures. I think we'll have far less focus on the borders in the coming weeks, and we'll need to really look at what we're doing amongst ourselves, how we're socialising, how much should we gather together, protecting ourselves when we're out and about and in shops and the like. That should be the emphasis.
Okay, thank you. And my second question, I know it's, I suppose, more linked to maybe education, but I suppose part of this strategy must include, we're going to expect students to come back from overseas. A lot of concern from parents who are very unclear on what's going on still. There's a survey that still hasn't finished. Christmas isn't that far away. People want to know what's going on. The closer we get to Christmas, there could be fewer flights, more expensive flights, puts families in a really difficult situation. What's going on there? There's a lot of people worried.
Well, we've committed to taking care of our students and bringing them back if that is what they want to do. And as you've mentioned, we have gone out to ask our students what their plans are so that we can have an idea of how many people might wish to come back and plan accordingly. And there is a lot of work going on to try and ensure that we can do this in a safe way, but we're not yet in the position to announce precise measures. But we are very conscious of the fact that this is an issue and we are addressing it.
But are we leaving it a bit too late? I mean, Guernsey know what they're doing. I mean, could be in a situation where we need to put on certain flights for students to get back. We want families to be together at Christmas, don't we? And that's a danger that if it gets too late and people who are struggling to afford flights and things like that, the later it gets, the more difficult it gets.
Well, it won't get too late. We will be announcing what we plan to do, but those plans are being worked up at the moment.
Okay, I'll leave it there. Thank you.
Okay. And Tom from the JP.
Good morning, Minister. Good morning to Dr. Muscat. We wanted to ask more about the nature of and then the detail of the testing, about who will get that. You mentioned 60% of people, maybe 40,000 in total. Who is going to be getting that, and what will there be measures to enforce that people take up those tests, or will they ultimately be optional?
Well, taking that second point first, no, there's no compulsion. This is a voluntary testing programme, but we would greatly encourage those employees in scope to offer themselves for testing, because it keeps them safe, their families safe, and the people they work with and the people they work for also. As to precisely who is in the groups, yes, I know the list, but I can ask Dr. Muscat to run through.
So the top of the list in terms of frequency of contact with people and risk of transmission to others would be healthcare workers in whatever guise they may be. So that includes not just the hospital and care homes, but primary care as a whole, community health as a whole, and also domiciliary care workers. People working in other public-facing areas would be quite diverse and includes people like taxi drivers, bus drivers, people in the blue lights, besides the ambulance, people in hospitality potentially as well. The list is quite large.
And is there any reassurance of there'll be people who'll be concerned that even though they're feeling fine, they're carrying on doing their job, that they might be hit with a positive test and have to isolate for 2 weeks and be suffer financially as a result of that? Is there a concern that they might be put off from doing the test? And is there support available if somebody takes a test and immediately finds that they're out of action for 2 weeks?
Yes, there is support available. There is an isolation benefit, which we introduced at the beginning of this pandemic, which would provide financial assistance. And there's other assistance if they are self-isolating and can't get out to get their necessaries and the like. I've mentioned the Connect Me system.
Thanks. And on the we've seen the numbers, Dr. Muscat, in the last couple of weeks as I think just a slight majority of symptomatic now over asymptomatic, but numbers in hospital remaining very low. From studying those cases, and I know we won't be talking about individuals, but the patterns that you're seeing, is there some cautious optimism there, or are you looking at the UK and the hospital numbers climbing and thinking that that's a real concern for Jersey?
I certainly think that if we do not take action now, if we do not respond proactively, that we will have a greater risk of going down the route of the rest of Europe and the UK. And that is indeed why we are encouraging people to be cautious at this stage, to be cautious preemptively, in order to avoid a rise in the number of cases across the community, which will eventually spill over into the hospital. So the virus is the same here as it is elsewhere. The people are the same here as they are elsewhere. What we can do, though, to protect ourselves is manage our behavior before there is too much virus around, to avoid spreading the virus. That is within our gift, and that's what we are on about. That's what we are trying to encourage people to pursue.
Great, thank you.
I think we've got time for one more question each, and we'll follow the same order. So, Gary, if you wish.
Thank you both. Dr. Muscat, I think it was early September, and apologies if I've not got the date quite right. In a press conference, you told me one of the things you were looking at for this winter was ensuring workers in care homes don't work in more than one care home, so they effectively aren't taking the virus into more than one care home. That isn't in your winter strategy. Why is that?
We have tried to encourage that last winter. Over the summer months, as the number of cases has gone down, we heard people saying that they could not afford, if you like, to live on one salary alone. Very often it's part-time work, of course. And we've therefore acknowledged that and said that given the number of cases that we've got, then perhaps it's reasonable. But we need to, now that we're going into winter, and now that we need to focus more on preemptive measures, we need to relook at that and try to encourage people to where possible, to only work in one area rather than in 2 or 3 areas at the same time. And we haven't found a complete solution to that yet, but it may be that if people work collectively together, so instead of 3 people working across 3 different areas at the same time, it's one person working in one of the 3 areas, that sort of thing. It may be possible that we can find a solution along those lines. So no one loses out, but at the same time, safety is increased.
So I was going to say, just to be clear, although it's not in the strategy, where possible you'd urge it, but you're also reserving the right to strongly recommend it, like the masks if need be, if you start seeing care home outbreaks?
If we see more and more cases, then we will encourage it more and more to stick to your particular place of work and one place of work and not many. And we may have to recommend it very strongly indeed through the Care Commission if necessary. But at the moment, we're trying to find a way that keeps the people safe, keeps care homes safe, without being detrimental to the employees themselves.
Thank you.
Reality.
Can you explain, our arrivals were supposed to be isolating or being monitored? Is it a track and trace team that's doing the monitoring or other agencies involved? And is social media monitoring a part of the activities like it was the case in the when the recent young woman was recently fined?
Yes, it is our test and trace team, track and trace team that is monitoring them for the different periods of isolation that are required, depending on green, amber or red. That is being done in all sorts of ways, by text messages, by phone calls, and I know if there's no response to those, then teams go out to knock on people's doors and check up on them. And as you have pointed out, yes, there's monitoring of social media sometimes, because that is a way of just ascertaining, what people are doing. So whatever measure is there, we have an enforcement function, and we are enforcing the rules.
Okay, and just I think you mentioned in the conference at the beginning that that this capability of like monitoring is being increased. Is that the case?
Yes, we want to enhance that role, particularly as we go into winter, because we know the risks, and we are seeing, it seems, that greater on-island spread. We're still in control of it, but we are seeing those cases arise on island. So we want to clamp down on that and make sure it doesn't spread. Enforcement is a key part of that.
Okay, thank you very much.
Charlotte, please.
You spoke about ramping up testing. Is there going to be any kind of introduction of self-testing, specifically saliva tests? I know that's something we spoke about a few months ago.
I was just speaking this morning with Dr. Muscat about that, so if I may pass over to him, because he's the expert on that.
We continue to look at all the new technologies that are coming along, and saliva testing is one of them. It has many benefits. It's easier to collect a sample. The technology that goes with saliva testing is, as from what I can gather, very good indeed, and equivalent. So we are looking at those newer forms of testing. How we deploy them depends on the particular circumstance that we find ourselves in, not just in terms of the epidemiology of the disease at the time, but also, of course, the specifics of the test as well. So we are looking at that. At the moment, we're looking at introducing antigen testing in the next couple of weeks, we hope. It's the IT connectivity is there, the instrument is there. We haven't received the tests yet, but they have been CE marked. They were posted last Friday, but I think there was some disruption with transport over the weekend because of the weather. But once that's validated, we hope to be up and running with that, and that will supplement the 4,600 or so tests that we can do per day at the moment. The next step after that would be looking at saliva testing. But I can't give you any sort of dates of introduction or what will be introduced and so on. What I can guarantee is that we are looking at the new technologies and will continue to do so.
Great, thank you.
Thank you. Harry.
Thank you. Long walk round. Mentioned Christmas slightly before, and normally around this time of year is when people start organising events, things like that. I think it's been mentioned briefly in the strategy. What can you say about people who want to, celebrate Christmas light switch-ons, events in schools, things like that? I know there's a few weeks to go on that, but what can you say about what you can expect that we can be allowed to do?
It's going to be a different Christmas, but we want to ensure that we can celebrate Christmas with our families. I personally doubt there's going to be large gatherings. Gatherings are limited to 40 at the moment on an organised basis, and I don't think that's going to change. So we will be putting out our guidance around Christmas. We've got officers who are working hard on that because we recognise the timescales and we recognise people want to plan. And we're going to do our level best to ensure that we can enjoy something of a Christmas period. But I've got no guidance at the moment that's finalised to give you.
Okay, and just finally, just on that same subject, I suppose especially difficult for the elderly people in care homes especially. What can you say on that front, people who are so desperate to see their loved ones but maybe feel at the moment like it's not maybe looking likely?
Well, we want care homes to remain open and for families to be able to visit their loved ones there. That's what's happening at the moment in a controlled way, keeping them safe, and I trust that we won't need to change that. So that can still happen at Christmas.
Okay,
Thank you. And finally, Tom. Tom says he's asked all his questions. So I think we're coming towards the end of this media briefing, and I thank everyone who's attended. But for those still listening, can I say thank you for listening to our message. We are in a good position in Jersey where we have managed to control the spread of the virus, but that is down to individual actions, and people have responded well to guidance in the past. We are entering a more difficult, a trickier situation, and therefore it is important that each of us consider how we can protect our friends, our neighbours, our families, and our whole island community. And that involves being much stricter with ourselves about how we behave. We need to try and avoid gatherings. We need to keep our distance from people. We need to observe good hand and surface hygiene. And when we do go shopping or in enclosed public spaces, please wear a mask. So everyone, thank you for what you're doing. Keep safe. Thank you. That brings us to an end.